Good evening, everyone. We are going to, actually, it's going to be good afternoon for you guys here in just a little bit. I'm trying to share my screen with you so we can go over your syllabus. But I just wanted to welcome you to DHG 125 Clinic Syllabus Review. We are just going to talk about your syllabus, and we're going to answer questions and just try to help you get ready to move into clinic tomorrow morning. So the first thing that you're going to notice about your syllabus is that you've got your meeting times. Meeting times are Monday, Wednesday, Thursday, and every other Friday. So we will meet Monday evening 5 to 9 o'clock, and then Wednesday morning 8 to 12, Thursday morning 8 to 12, and then there will be a couple of you that will have a Thursday afternoon clinic just because we couldn't fit everybody in on the times that we had. And then there will be all day Friday, 8 to 12, 1 to 5, and like I said, it's every other Friday. It's not every Friday. Next thing you're going to see on your syllabus is that we have a list of instructors. These are all of the instructors that will be present on the floor with you at one time or another during your week when you're on clinic. If you have any questions, the emails for myself, for Ms. Kazire and Ms. Egan are listed. We also have our phone numbers and the office numbers as well. The next thing you'll notice on your syllabus is that there is a description. It's just a description of the class, of the clinic, and then you have outcomes. These are just the general outcomes. And then we have course objectives. The course objectives are the objectives that you will kind of do throughout the semester. So by the end of this course, the students will be able to, so you guys will be able to do these things by the end of the semester. The reading materials that you will have for clinic are going to be Mosby's Dental Drug Reference, and then the Wilkins, the Clinical Practice of the Dental Hygienist. Those are going to be your two textbooks that you will use the most for clinic this semester. The next thing that we see is evaluation, and this is our grading policy. Actually, these are going to be your requirements that you have during this semester of clinic. The first requirements listed off are just your graduation requirements. So these are accumulative from this semester to your very last semester. So you will not do all of this for just this semester. You will have semester competencies. These semester competencies will be real similar to what you had in 115. You will have rubrics that you fill out, and we would encourage you to make copies of all of the rubrics that are on Moodle right now. So all of them should be out there and ready for you to use. So make your copies and keep them with you because you never know when you may need them. And if you don't have them, then you can't do the rubric. All right. So those rubrics need to be self-evaluated prior to the evaluation of the skills. So you need to make sure that you fill those out just like you did in 115. Not much different there. The competencies for this course that you will complete will be that you will complete a dental hygiene comprehensive care for the adult patient. So you will have one patient that you work from beginning to the very end when you provide fluoride for that patient. So you will go from collecting assessment to doing fluoride on that patient. You will go from step 1 to step 10 or 11, whatever it is that it takes to finish out a patient. You will also have one patient that you do only assessment on. That doesn't mean that you can only do assessment and then you don't do anything else to them. Once you've completed the assessment, you can move right on into cleaning their teeth and working on them that way as well. And in fact, your assessment patient can also work for some of the patient care service competencies. And I will try to explain some of those a little more here. The next type of competencies that you have are your patient assessment competencies. These will be health history, gingival assessment, your dentition charting, oral inspection, periodontal charting, and probing. These competencies are done on a patient that is not going to be one of these patients, either your adult or your assessment. So here's you another patient that you will need. And if you have one patient that you can do all of these on, that works out well, you may need another one to do something else on. So the next thing we see is patient care service competencies, and these are your oral hygiene instructions, your instrumentation, your stain and plaque removal, and your fluoride treatment. These competencies can be completed on your assessment patient. Okay, so you are able to do these after you've made it through check-in with your assessment patient. Other requirements to competency will be an FMS. You will have one that is you'll have two FMSs, one that is graded with a competency rubric, and this is your very first FMS that you will ever do for clinic class. The very first one you do, you have to have a rubric. You have to have a rubric, so don't forget that. All right, with your very first FMS, you need to have that rubric and ready to go. You will have a start time and a stop time with this rubric, and we will talk more about that here shortly. This has to be completed prior to attempting another FMS for a grade. Okay, you have to successfully get through the competency rubric before you can do another FMS for a grade. The next FMS is for a summative grade. You will work to get 80% for the competency. You're going to have 3 bite wing sets. The very first one will be graded with a rubric, and you have to complete this one before you can get credit for the other 2 bite wings. All right, you can't skip the rubric and move right on into getting credit for bite wings. You have to do the rubric first. Once you've done that, then you can move on into bite wings, the 2 bite wings. With these, you're going to have each of them graded by a peer prior to the instructor grading the same survey. I know it says only one survey, but you have to have both of them graded by a peer. Every time you do any type of x-rays, they have to be graded by a peer first before they go to the instructor. You also have a digital bite wing set. These will be graded just to satisfactory levels, so you will just pass or fail these. There is no percent given to you. It's just a pass or fail grade. You will also have an instrument sharpening competency. This is something that we're going to try and get done this week when we are working on peer patients, this week and next week. So we will try to get the instrument sharpening comp completed then, so that we don't have to go into the semester trying to get this competency done. You will have a mounting of a full mouth survey. You will also have a radiographic interpretation, and I do believe that Ms. Curtis has worked with you on how to write out a radiographic interpretation and how to grade your radiographs. So this is one of your requirements that you will have to do. You will have an identification of a radiographic landmarks. You will have 2 of those, one on an FMS and one on a panoramic film. You will also have an autoclave operation that you have to demonstrate use of the autoclave to one of your instructors. You will also have a pre and post appointment disinfection. This is done for a peer, not an instructor this semester. You will have a calculus detection and charting. You'll have 1, and then you'll have to be able to get 6 debridement points. Okay. You'll have peer evaluations. Peer evaluations, these are evaluated by a peer on the floor. So the peer will record satisfactory completion on the student operator's grade sheet if the student satisfactorily completes the evaluation. Okay, so these evaluations you as the operator have to do for a peer. So a peer has to watch you do them, and then once you've done them for a peer, they will sign off on your grade sheet. Okay, whether if you pass or if you fail. If you don't, if your peer says no, you need to redo, then you'll have to redo the evaluation for another peer. Okay, so you're going to have 2 instrumentations. You're going to have 2 oral hygiene instructions that have to be listened to by a peer. You will have a review of operation of panoramic radiograph unit. You have 1. You also have radiographic landmarks that a peer has to do with you. And then we have peer requirements. These are requirements that the peer has to get while they are serving as a peer on the floor. Okay, so a peer will have a grade sheet, and these will be recorded on their grade sheet. So they will be responsible to get an FMS grading. So once you've graded an FMS for one of your operators, then make sure that you keep track of when the operator gets it graded by an instructor. And if you are within 5 points of what the instructor grades it as, then the instructor can sign your paper, your grade sheet. Same with the bite wings. You'll have 2 that you'll have to have signed off by the instructor saying that you are within 5 points of what the instructor graded the same survey with. You'll also have 2 oral hygiene instructions that you have to listen to, and your student operator has to sign off on them. Once you've listened to the oral hygiene instructions, your student operator can sign off on it. You will have 3 instrumentations that you have to watch a student perform, and once you watch them, the student operator will sign your grade sheet. One of those is the 11-12 Explorer, 1 is a scalar, and 1 is a universal curette. All right. This little box here, it says that health history check with the instructor, the student should bring the approved treatment plan to discuss the initiation of debridement with the instructor. So once, actually I'm not quite sure why it's right there, but it is, so let's talk about it for a minute. When you have a patient and you have moved past check-in with that patient, you will have a treatment plan that will have been signed off by your instructor. Once you have moved all the way through that area, and if you have to bring that patient back to do debridement, when you have them there doing debridement or getting ready to do debridement, at the health history check, you will bring up that treatment plan so that the instructor can see the treatment plan and sign off for it for the day. We will talk more about this here in a little bit, or we will talk more about it up on the floor when we do peer patients this next week. So this next week is for you to ask questions, for you to learn the ropes of clinic, how things go. If you have a question you want to ask your instructor, now's the time to do it while you're learning. This is a good week to learn. You will also have an instructor teaching debridement that you will do, and this is with each patient over the age of 16. The student will sign up for an instructor to help. When you sign up for help, you're going to put debridement beside the word help. The instructor will assist with random supragingival and subgingival, calculus detection, instrument selection, review of fundamental instrumentation, and effective deposit removal. So if you have a question, sign up for help. If you're having a hard time finding a piece of calculus, or if you don't know if it's a piece of calculus and you want someone to check, you can sign up for help. If you're having a hard time removing calculus, don't hesitate to sign up for help. A lot of times we have ways that we can help you learn how to get calculus off that you may not remember from class. So just ask us. We'll come over and help you. Debridement points awarded may vary depending on the degree of assistance during the instructor teaching. So during that time when your instructor is helping you with certain aspects of the appointment, if they help you a lot, you may not get as many points as you would have if you had done it more on your own. And that's not bad. It's just that if you don't get the points, this is probably why. You will have an exit outcome assessment. This is just like our outcomes that we took this past fall. So you will have the last day of clinic, you will have a written test, and you will have a clinical skills that you have to perform up on the clinic floor. Hopefully this semester we'll do it a little faster. Hopefully we don't take quite as long as we did the last time. We are going to have 3 instructors on the floor instead of just the 2, and I believe that Doctor's going to proctor the exam. The evaluation procedures, you can see your clinic grading system in the program manual. I do believe it is page 70 in the handbook. Okay. Peer evaluation. So students will provide, it's page 70. Students will provide feedback to peers for certain clinical skills. Expectations include but are not limited to providing evaluation for peers as requested, working with peers to solve clinical dilemmas, strengthening critical thinking skills. The purpose of this evaluation is multifold. The operator will receive feedback for clinical skills in a non-graded format, allowing that student the opportunity to gauge progress and performance level. The operator can utilize the feedback gained from a peer evaluation and conduct a self-evaluation for that skill. The peer evaluator will be able to observe peers and help critically think through areas of uncertainty in patient treatment while picking up helpful information to incorporate into practice the next clinical situation. So not only is the peer helping the operator, but the operator is helping the peer with helping to learn through different situations. So the peer may learn something when they are helping an operator work through situations that they can take to when they are an operator. So the peer evaluator will use the grading criteria established in the program manual, which is an S or a U. You will indicate that on the respective line of the grade sheet along with your initials. So I have pulled up the grade sheet. This is your grade sheet for this semester. Make sure your grade sheet is going to be cherry colored. Mine is white right now. Same with my rubric or my syllabus. It is white on the screen, but yours is cherry. Make sure you put your name here. Every time you have your patient in the chair, make sure you date for the treatment. Okay? Your patient's name goes over here under the name. Make sure you write their age. All right? And then they will have an ASA. And we will talk about that later as well. Up here, you've probably looked at this morning. You probably looked at all of this with Miss Eckelberg. So I won't go into too much of it here. But here is where the peer and the instructor will sign off. So when an operator or a student performs a skill, then the peer has to sign off. So here is pre and post appointment disinfection. This skill, only the peer will evaluate this semester. Instructors will not evaluate this. So we have a P in this box. They will sign off on the pre and they will sign off on the post. Over in this box here, the instructor or the peer initials it. So you're going to want to put a date and you're going to want to initial it because these grade sheets are used over many times. As many times as the patient comes in, these grade sheets come out the same. You don't get a new one for each patient. We use the same one. So make sure you date it. So peers date when your operator does a skill and then initial. Over here we have OHI. If it's the peer that listens to OHI, circle the P, write and specify whether the operator did it satisfactorily or did not with a U, and then make sure you date and initial. If it's the instructor, we will circle, we will put our grade here, and we will date and initial. Peers and instructors cannot listen to OHI on the same day. You have to make a decision, operator, as to who you want to listen to you on that day. We can listen on opposite days or different sessions, but we cannot listen to you during the same session. Same with instrumentation. Cannot do it during the same session. You have to choose between a peer or instructor. Once again, give the grade and give the date and initials. Here are radiographic landmarks, PANO and FMS. If you do both on the same day, they're both circled on the same day and dated. Circle P or I, whoever does it, grade and initials. All right. And then there are rooms for comments. So each time you have the patient come in, you will date and you will make a self-evaluation. So you will make comments as to how you felt about that clinic session. Make sure that you're looking at your skills and are self-assessing them. And if you are struggling with a skill, I would like to see that you write something down that you could do to help yourself, whether it be that you practice on a typodont, whether it is that you ask an instructor or you ask a peer to help you out. All right. Okay, so that is your grade sheet. The peer evaluator will also do, let's see, the skills students can evaluate at this level. So the peer evaluator will do your pre and post. They will do your health history check prior to the instructor check-in, or the instructor check-it. So when you have completed your health history review with your patient, you will go to your peer to have them look at your health history and make sure you've got it completely filled out right. So you look for anything that needs to be circled, any allergies or pre-meds that need to be written at the top in red. You look for everything that needs to be done and make sure that your operator has it done correctly. Make sure that all of the drugs are looked up and ready to go, all the boxes filled out, and then they are ready to see the instructor. Peers will also look at the exposure and the grading of the radiographs. They will determine sharpness and dullness of instruments. So you will go around and check your operator's instruments for sharpness and dullness. They will listen to oral hygiene instructions and observe instrumentation. And then as time allows, which time will allow, the peer evaluator can and should do calculus detection and exposure and evaluation of radiographs again, interpretation of full mouth radiograph surveys. They're going to look at the sharpness and dullness of instruments, instrumentation, oral hygiene instructions, and stain and plaque removal. But back up here at the calc detection. After an operator has completed their calc detection on their patients, they will come and sign up on the peer island on a sign-up sheet for their peer to come check their calculus. The peer has to check their calculus before an instructor will come check the calculus. Okay? So peers will have to check the sign-up sheet and keep up with that as the session moves on. One note here is that the peer evaluators will be responsible for checking post-appointment disinfection procedures for each unit. Failure to properly prepare the unit for end of treatment will result in all competencies negated for both the operator and the peer evaluator. All right, this is peers need to go around and make sure traps have been cleaned, taken out and washed, cleaned. Make sure that all of the lines have been dried, so that means that air has gone through them. We've dried out the air water syringe, no water is still left in it. So peer evaluators will have to go to each operatory and check each of these things before the operators leave the floor and before the peer can leave the floor. So the peer will be there probably almost to the very, very end of a session, because they cannot leave until they have checked the cleanliness of each of the units. If one of the units are found unclean by an instructor, the peer and the operator both face the possibility of losing the competencies that were completed during that day. And that's not a good thing. We want to make sure that you keep your competencies, so make sure that you're staying on top of this and that you keep things clean. One last thing for the peer evaluator is that we have a journal up on the clinic floor that at the end of each session you will write information down. You will write skills that you've gained. You will want to write down the strengths that you were able to demonstrate, maybe something that you helped an operator do that was new to you, new to the operator. Maybe you helped them to critically think through a treatment plan and help them come up with an idea of what to do. So all of these things can be added into the journal. So just don't forget that that needs to be there, or that you need to fill that out before. All right, you do have peer requirements. We've talked about that. The next part of your syllabus is daily patient services. And daily patient services are the things that you provide for a patient that comes to the floor and that they're not a competency patient. So they are mainly just a formative patient. So when you do check-in, we look at each of these areas: dental charting, periodontal evaluation, gingival assessment, treatment plan. And that is it. Okay, so under each of those areas, there is something there that you need to read through. Okay, I'm not going to read through it for you, but I'm going to have you read through it. But when we give you points on your grade sheet, this is what we look at. So when we do your health history checkup, at the very beginning, after you've gone through your health history and reviewed it with your patient, what we look for is that you've met this criteria here, that you've completed all of the patient information, that you've asked your patient questions and marked them appropriately, that all of the medications were looked up and recorded properly, that your blood pressure was taken and indicated and recorded properly, and signatures and dates completed, and conditions requiring special attention such as pre-medications and allergies were appropriately recorded. If you don't do one of these things, we take a point away, but we expect you to have at least 3 points in this area. If you do not, then we need to be looking at what needs to be reviewed so that we can get you up to at least 3 points. Don't forget, the peer evaluator must look over the health history prior to taking it to the instructor. An instructor will guide the student to the following areas if needed. If you need help looking at medications, if you need help to question the patient on medications, we'll help you ask questions and come up with questions and see what, help you do some things with them that you need to learn how to do. Maybe questioning the patient on an allergic reaction, or clarification on a medical condition that's listed on the form, and maybe the patient doesn't understand why it was marked, or why you're asking questions, why you want to know. So we can help you out with all of that. Next is oral inspection. These points won't be given to you until after we've completed a check-in for you. All right? We expect you to be able to have 5 points in this area, and each of the things listed down here is what gives you those points. If you can't get the expected formative grade of 5 points, it's the same as with the health history. We need to start looking at something and help you come up to speed, because this is what you need to be at. There's the dental charting. Your expected formative grade is 7 points. Within this area, there is chartable items. This is dental charting. So if your patient has let's say 6 to 10 chartable items. That's fillings, that's crowns, that's sealants, stuff that you put into the dental charting. You have 6 to 10 of them. The number of allowable errors is 0 errors for 10 points, 1 error for 7 points. Same with 11 to 20. You will see points for each of the errors that you would make. It is the instructor's discretion in determining the student knowledge on chartable items. Sometimes composites are hard to see. Sometimes it's hard for us to see a composite. And so if you missed a composite that was done really good by a dentist, and we have a hard time, then maybe we won't count that as much of an error. So it's up to our discretion. The instructor will help the student distinguish between composites and sealants, precious metal and stainless steel crowns, etc. Next is periodontal evaluation. We expect you to be able to have 5 points out of 9 points. So when we look here, we will help you come up with a PCT type when you go through check-in with your patient. So we see type 1 is going to be gingivitis. So if we say your patient is a PCT of 1, we would expect to see this type of inflammation of the gingiva, maybe some color changes, maybe the form of the gingiva is a little different. So we would expect to see that. And we have a type 2, which would be slight chronic periodontitis, usually 4 to 5 millimeters of attachment loss. Type 3 goes on up higher, 5 to 7 millimeters. And then type 4, which is advanced chronic or aggressive refractory periodontitis. So we will help you with this part of the exam with your patient. We will help you come up with a PCT type. Eventually, you'll get to the point where you can come up with it, and it's not a big deal. Gingival assessment. There's 13 points here. We expect you to be able to get 7 of them. So 1 point will be awarded for each facial and lingual sextant of gingival tissue accurately described. Remember when we did that in 115? It's not too hard. You just have to pay attention to your color, your consistency, the contour, the texture. Make sure that you're looking at everything. We want to see that you can determine a gingival statement for a gingival assessment. And here are your gingival statements that you'll want to use. So you'll have plaque-induced gingivitis. If it's not induced by plaque, you'll have something to write about it here. You'll have periodontal disease where you need to write a specific statement there. When we do your calculus detection during, actually we'll check it, a lot of times we'll check it before we do check-in, because once you've had your peer check your calculus detection, you're able to sign up for the instructor to do the calculus detection. Once we get those calculus pieces located on your detection chart, then we add them up. And we will show you how we add them up when we are on the floor with you and your patient. Your patient won't see us do it, but we'll do it with you. So a light calculus would be less than or equal to 7 surfaces in the entire mouth of supra. Subgingival is below the gum tissues, and that is less than or greater than, or less than or equal to 7 surfaces as well in the entire mouth. Medium would be greater than 8 surfaces and less than 15. Same with subgingival. Heavy is going to be greater than 16 surfaces. in the mouth, or 15 surfaces per quadrant. Same with subgingival. And we'll help you count those up and show you what we do. All right, treatment plan. There is 11 points possible with the treatment plan. We want to see that you get an expected formative grade is 6 points. If you can't get to 6 points, then like I told you with all the earlier ones, we will work with you and try to get you to be able to make it to the 6 expected formative grade. So for the treatment plan, what we want to see on the treatment plan is by check-in, the student will complete the date, the appointment number, the student name, and the patient name. Assessment, you're going to have all assessment data must be correctly recorded. So you have to have all of your sheets together and ready to go. The planning, patient concerns must be completed. The instructor will help with determining priorities and goals. Estimate of treatment, the student will complete the fees section based on the scheduled number of appointments and other services recommended. So you need to be able to do these parts of the treatment plan. For the informed consent, the student will present the treatment plan to the patient or the guardian if it's a child while the instructor is present, and obtain a consent or refusal. So you'll have to get a signature of your patient for the treatment plan that you determine is best for them. We will listen to you, present this to your patient, and if you need help in presenting it, then we will be able to help you or assist in portions of it that you may need help with. The implementation portion of your treatment plan, you will attempt to complete this section without assistance. The instructor will assist when multiple appointments are needed. The student will complete OHI based specifically on assessment findings. And you will discuss oral physiotherapy and technique. You will have instrumentation for initial appointment, include sequence of treatment and specific instruments to be used. Polish the type of grit, care of oral prosthesis if they have one, and then fluoride treatment type and percent. There is examples in your handbook. So don't get bent out of shape about how to fill out a treatment plan yet. These are not hard to fill out. You have examples that you can follow, and you can use those examples to fill it out. We don't expect you to memorize how to fill these out right off the bat. As you move through the semesters, you will be able to, by the end, you will probably be able to do it without any problem. So after check-in, the instructor will discuss findings with the patient and the student and observe case presentation. The instructor will also discuss patient classification with the student, help the student determine priorities and goals and the number of appointments, and review with the student the need for local anesthesia if your patient needs it. At the checkout, the instructor will assist the student in determining the recall date. If a single session appointment. If multiple session appointments, the instructor will assist the student in determining evaluation and implementation for the next appointment. So when we check your patient out, we will help you fill out the next section if they're going to come back for what you need to do during the next appointment with that patient. And then remember, we talked about carrying this treatment plan up with your health history. It's this portion that the instructor will sign at the next appointment. All right, so note the student must follow the treatment plan as approved by the instructor, or credit will not be given for the formative grade, and a U will be given for professionalism. So on the treatment plan, we write everything out that you're going to use. We're going to write out the instruments, we're going to write out the fluoride, the paste that you're going to use, OHI, the instructions you're going to use, the type of toothbrushing instructions you're going to teach your patient. And so if you decide that you want to change something in the treatment plan, you need to have an instructor watch you at it and then initial it. All right? You have to follow what's on this treatment plan. You can't just go off and do what you want to do with your patient. We've already got it planned out what needs to be done, and you have to follow those what's been planned. All right, you have a plaque-free score. This is to be completed at each debridement appointment by the student. So once you move past check-in with your patient, you're going to want to do a plaque-free score at each appointment that you clean their teeth, that you debride teeth. You have to do a plaque-free score. We do not evaluate on a daily basis, but must be evaluated with your comprehensive care patients. And those are the patients we talked about earlier, your adult patient and your assessment patient. We assess the plaque-free score. Oral hygiene instructions are not evaluated on a daily basis, but you do need to review with your patient. When you do a plaque-free score, each appointment that's for debridement, you should review with your patient how their home care is going. How are they doing with the toothbrushing instructions you gave to them the last appointment? You know, maybe the plaque-free score is better, so you can mention to them that the plaque-free score is looking better than it was last time. Are you able to brush and floss like I showed you the last time? Or, you know, just talk to them and make sure that you review their care. Oral hygiene instructions, though, will be evaluated by the instructor for your patient care service competency and the adult comprehensive care competency. All right. So the following information down in here you have to include with your oral hygiene instructions. I'll let you read that. The debridement, calculus removal, competency is based on the number of allowable errors. Remember, I don't know that I've showed you that yet. All right, so what we see with light calculus, you can have a maximum of 3 errors. So with the light calculus, you can miss 3 subgingival and 3 supragingival. With the medium calculus, you can miss 5 subgingival and 5 supragingival, and heavy calculus 7 sub and 7 supra before it really affects how many points you get. The debridement points will be awarded at the completion of the patient treatment or at the completion of a unit of heavy. So we don't give points when you finish a quadrant, especially if your patient is a light calculus. If your patient has a quadrant that is heavy, then we can give you the heavy points for 1 quadrant of heavy, but that is something that we'll just have to determine as we see your patients. Supragingival calculus must be removed within the number of allowable errors in order for any debridement points to be considered. So when we check your calculus, when we check it, we don't want to find supragingival calculus sitting there still. It needs to be removed. So these are the points that you would earn when you are finished debriding your patient. So for a light calculus, you can earn 2 points if they are a PCT of 1. Down here you'll see if the patient's a PCT of 3 and they're light, you can earn 3 points. And then it just kind of goes all the way down to heavy, where the patient is a PCT of 4 heavy and they get 6 points for a heavy. The minutes that you see here, time allowable for instrumentation, these are not anything to you at this point in time. These are something that you can use to help you determine how fast you are going. So you should be able to complete towards the end of your time in dental hygiene school. You should be able to complete a light calculus within 45 minutes with a PCT of 1. So you've got the minutes listed out here all the way through. For stain and plaque removal, your expected formative grade is 5 points, and you can miss 3 allowable errors. So if we find 3 places of supragingiva, or I'm sorry, 3 pieces or 3 places that you didn't get polished off that still has some plaque sitting there, you've got three spots before it starts to affect your points. We've got topical fluoride treatment. It's not evaluated on a daily basis, but it is evaluated for your comp care patients. All right. All right. Let's see. All right. Let's see. Grading patient assessment competencies. Patient assessment competencies are going to be health history, dentition charting, gingival assessment, oral inspection, periodontal charting, and probing. These competencies must be completed before the dental hygiene care for the adult patient, and the dental hygiene process of care assessment competencies can be checked in by an instructor. So these are our mini comps. These assessment competencies can be done on one patient, or you can have 2 patients if you want to. But you have to have a patient that you can do these competencies on, and there's no specific requirements except that they are just able to be with you and be there at the clinic several times. So maybe mom or dad might be a good one that you could do these on, or sister or brother, if they can sit in your chair for several times, because you may have an appointment with them and you think, well, I can get health history done, I can get oral inspection done, and I can probably get to dentition charting. You may be able to, but the problem of it is the other 14 on the floor might be thinking that as well. And there's only 3 instructors. And so we may only be able to get to you for 2 of those 3 that you think you can do. So you want to make sure that this patient can come back for you several times and let you do these on them. Okay? Now this patient cannot be one of your comp care patients. So your comp care patient is going to be the adult patient that we talked about, where you start from the beginning and you end with them. You can't do any of the mini competencies on them. All right? Same with the assessment patient that you have. Your assessment patient is your assessment patient. So you can't do a health history comp on them, and you can't do a dentition charting comp. You have to do all of the assessments on that patient without doing competencies. That they are your assessment patient. Okay? And this is where it all kind of gets tricky, and I really am sorry that I can't be there with you to answer questions, but I know that Miss Eckelberger can do her best and answer what you might have to ask. If you need me to answer something, just we'll catch it on the floor when we do peer patients, okay? Because like I said, this next week is going to be just a learning curve for you guys, learning how the ropes of clinic move and what you can and can't do. All right, so your patient assessment competencies can be done on a patient, on one patient. You can have 2 patients to do these competencies on. It doesn't matter. But these competencies can't be done on the 2 patients that you're going to use for comp care. Okay, those 2 patients have to be reserved only for your comp care requirements. All right. All right, you do have a rubric for health history. You can read through each of these as we go through. I'm not going to read them to you because it'll get way too long. The health history has a rubric. Your patient selection is that your patient must be taking at least 1 medication daily. And I need to apologize for my dog barking. I am doing this at home this evening, and my little dog's decided that he has heard something and he needs to bark. So, hold on a second. Jonah. All right. So, now we've got health history. You can, sorry. The next one we're going to look at is oral inspection. You will have a rubric for oral inspection. Your patient selection can be any. You will have 15 minutes to complete this evaluation. All right. Dental charting is graded with a rubric. Your patient has to have at least 5 chartable items. That means there needs to be at least 3 restorations. So you could have 2 missing teeth and then 3 amalgam fillings, or 2 crowns and an amalgam filling and missing teeth, 2 missing teeth. You'll have 15 minutes to complete that. Probing has a rubric. You have to have a minimum PCT of 1 for the probing. Your instructor will choose 2 sextants for this evaluation. You have 10 minutes to complete the evaluation. You have a periodontal evaluation, exactly like what we did in 115. Probing and perio can be done together. Grading for the periodontal evaluation has a rubric. Your patient has to have a minimum of PCT of 1, and the instructor will choose 1 quadrant for this competency. You will have 15 minutes to do it. The gingival assessment, you'll have a rubric. Your patient has to be at least a PCT of 1. The instructor will choose 2 sextants. All right. Next, we look at patient care service competencies. These are not your mini comps, but they are competencies that have to be completed. And these competencies must be completed before the dental hygiene care of the adult patient competency can proceed past check-in. So what we like to tell you to do is these competencies here, the oral hygiene instructions, the instrumentation, the stain and plaque removal, the fluoride treatment. Once you've completed your assessment patient, because all you do with your assessment patient is those assessments in the front end. Once you're past check-in, you're done with that patient. There's nothing else to you. You do need to finish cleaning them, so why not use them for these competencies? All right? So once you get past check-in, do oral hygiene instructions and get that competency. Move on and do your instrumentation, your stain and plaque removal, and the fluoride, and then you've got them all done. These competencies need to be completed before you can move too far past check-in in your adult patient. Your adult patient, remember, is your beginning to end patient. So we kind of have timelines here. You need to make sure you're keeping everybody rolling. So for these patient care service competencies, you've got a rubric for oral hygiene instructions. Patient selection is any, and you have 15 minutes to complete. Your instrumentation has a rubric. Patient selection is any. The instructor will choose 2 sextants and 2 different instruments for each evaluation. The student will have 10 minutes to complete the evaluation. You've got stain and plaque removal. The grading will be done on a rubric, and you can have a proof treatment plan with service planned. So any patient that you have that you've already written it on the treatment plan and it's been planned, you can do that on. The instructor will choose 2 sextants for each evaluation, and the student will have 10 minutes to complete the evaluation. Your fluoride treatment has a rubric as well. Approved treatment plan. You have to have an approved treatment plan, and then you can do it. Make sure you come prepared to clinic. Make sure you print off all your rubrics. Have them ready to go. I would even print off an extra 1 or 2 just in case one of your peers needs it and they've not been responsible enough to bring their papers to class, their rubrics. All right. Okay. I'm going to pause the video right now. Actually, I'm going to stop it because it seems like processing takes a long time. So I'm going to stop the video and I will start it up again here in just a little bit. and we'll finish out the rubric or the syllabus.